Hi, David Liew from Melbourne, Australia for Room Now for ACR 2020. And I wanted to tell you a little bit more about some of the GCA data. I know we've been talking about this for the last few years, but now we've got continuation data. And what we're doing is actually getting some really interesting data coming out of this about questions that we have about GCA and about tocilizumab treated patients in GCA, which is proving really useful now that tocilizumab is close to being or is standard of care in GCA if and when it's available. So the first bit, two abstracts presented by Sebastian Unizzoni at this meeting. The first one related to the nature of flares on tocilizumab. And I think there had been some concern previously that tocilizumab might be pushing down a part of the GCA response, but the interferon gamma part of the response, the bit that might be actually concerning as far as intravascular events are concerned, might actually be particularly a problem. So looking at the flares for patients on tocilizumab, are we seeing a whole bunch of patients with visual manifestations or strokes? Well, thankfully not. Visual manifestations, very rare in the GCA cohort as far as flares on tocilizumab are concerned. The other question, of course, is tocilizumab classically takes away your CRP and ESR. Are we seeing elevations in ESR and CRP in these patients who are already being treated with tocilizumab and have flares of their giant cell arteritis, which we're detecting in other ways? Well, helpfully, if you take the ESR and CRP combined, 3/4 of patients have a raise in their ESR and CRP during a flare of their GCA, at least as was defined by the clinician when they were on tocilizumab. Now, having said that, a lot of the contribution there is from the ESR. So we're talking 71% of the new onset GCA and 60% of the relapsing GCA had the increase in ESR, and CRP was much less. So 35% in the new onset GCA, and then 40% in the relapsing GCA. So really, the question is, do we have anything else that can help us with a biomarker that can help us to try and detect flares in GCA patients who are treated with tocilizumab? The next bit was that they looked at a few patients using some quite nice technology, really, using mass spec, but with Tandem Mass Tag technology, with a multiplex, 11-plexed Tandem Mass Tag, but basically to try and pick up the proteins that were getting increased in these patients with GCA relapses, comparing to the times when they weren't, labeling them, indexing them, and try and understand where all these candidate proteins might sit. So they ended up seeing 344 candidate proteins and then ranking them. And right at the top of the list was haptoglobin. Now, that's something which we can use, which we can order right now. And that's something that was going back to the 1980s. Sarah Mackey has pointed out to me some of the literature regarding this, that in fact, there are descriptions of haptoglobin being really useful when inflammatory markers conventional inflammatory markers, ESR and CRP, weren't elevated. Now, of course, we want to see this in prospective study. We want to validate this in different cohorts, but it certainly raises prospect that there probably are biomarkers out there that can help us when patients are receiving tocilizumab. Now, I should say as well, they took a bundle. If you take the top 10 and you put them together, you get really nice test performance. You get really nice AUC on this. But really, I think looking at haptoglobin, that's something simple, and that might be something which might be at your clinic bedside soon. For more on vasculitis and on everything that's at ACR 2020, head along to roomnow.com.